Healing Hands Health Society, in collaboration with our in-country partners, present Feed the Hungry Nigeria. Nigeria is on lockdown. With this stay-home order, hunger will be on the rise. We cannot fold our hands and wait. We have partnered with caterers and non-profit organizations to distribute food in Lagos, Ibadan, Abuja, Kaduna, Warri, and other major cities in Nigeria. To support the Feed the Hungry FTH project, you can send your donations to the account below. Account name: Healing Hands Health Society. Account number 0803479982, or go to GoFundMe Relief Mission to Nigeria. For sponsorship, please call 08023229290 or email us at info@hhan.org.
All right. Welcome, Dr. John Sampson of Johns Hopkins University. Could you just introduce yourself to our viewers, sir?
Yes, how are you doing? My name is Dr. John Sampson. I'm an associate professor of anesthesiology at Johns Hopkins University, of which we have an organization called the Global Alliance of Perioperative Professionals. But I'm also the president of a nonprofit known as the Institute of Global Perioperative Care. And we do a lot of projects that are designed to leverage technology and capabilities of the healthcare system here to improve healthcare in Africa.
All right. I know you are in Maryland, Baltimore, Johns Hopkins University, and you are right there as a clinician, and you are saying, what is this real? Is COVID-19 real?
Yes, COVID-19 is definitely real. Just a few moments ago, we actually had a patient who needed intubation, and in the process of putting the breathing tube in, the patient, even had a situation where they, experienced a cardiac arrest. So definitely, definitely, this is a real issue.
So this is not going away. For those of you out there who think that this is a joke, who think this is a hoax, or this does not affect certain groups of people, from your experience, you think that everyone in the population is equally affected?
So everyone in the population has an equal risk of getting the COVID-19 infection. However, different population groups within any group, body of people has a different risk of actually having life-threatening severe illness. And but within that, even if you don't fit classically within a group that has that risk, you still have the possibility of having such an illness. And so there's even been a 5-year-old child that had it. There have been healthy 30-year-old and 20-year-old people who've also had this problem as well.
So right now, what are you using to manage your patients? Because we're hearing from the news, you cannot use chloroquine, you cannot use mefloquine, you cannot use, Zithromax. What is the hope that we have at this point?
So all of those things are specific agents that really were designed to address some other different type of infection. So it's not as much of a surprise that none of those work. It would be more of a surprise, actually, and more unusual for any of those to work. In other words, if I have an antibiotic like azithromycin that's really designed for a bacterial infection, is it surprising that it doesn't work on a viral infection, or is it more or less it would expected? In other words, it would be more surprising that it would work on a viral infection. Hydroxychloroquine, which works on malaria, which is a parasite, it's not a bacteria or a virus, it's a parasite, same thing. it would be more surprising that it actually worked. And so they were looking at these other things to see if any of them would work.
So what are you guys doing now in your hospitals? What's the protocol?
So when you ask for the protocol,
so an individual comes in, is tested positive, and he has respiratory symptoms. What is he being given?
Right. So let's backtrack just a little bit,
Okay.
and let's address the issue of a person having COVID-19, which is the technical term for coronavirus infection, the not new one. If you come in and you have symptoms of this to any hospital around the country, first of all, they don't want you to come to the hospital. They want you to call in to your primary care physician and discuss with them what your situation is. They don't want the emergency rooms full of people infected with this. That means if you enter any emergency room, you're almost guaranteed to get it. So if you're suspected to have it when you call and you think that you actually are sick enough where you might need, hospital attention, most of the hospitals will have a tent or some kind of facility outside the hospital where they can screen you without you actually coming in to their emergency room. Now, if your symptoms aren't so bad, because they're trying to ration the testing, what they're going to do is they're going to say, well, your symptoms aren't, all that bad. How about we're going to have you go home. You probably have this infection based upon your symptoms, and we don't need to test you. Just go home and just take care of yourself, isolate yourself, quarantine yourself. So they're not going to give you any a particular treatment like that. They're going to ask you to self-quarantine. So that's pretty much how it is. So now let's say you're sick enough where you're having respiratory symptoms. You may have a decrease in your oxygen level in your blood, and you need hospital attention. Well, in that case, what they're going to do is admit you to the hospital, but there's not any of those treatments that you're necessarily going to get, because you're mainly going to get supportive treatment, and they want to watch you to make sure that if you get worse, that they can give you life support like mechanical ventilation. And how you would get worse is that your oxygen level would go lower.
So no medication is going to be given to you. So how do you intend, if you have a low immune system, or you need a boost in? So what is being offered to this patient? You mean nothing? Because a couple of my colleagues have told me that in their hospital, hydroxychloroquine is still being administered.
So yes, so hydroxychloroquine is being administered by a lot of people. Unfortunately, the studies that have come out from several countries, including Brazil, China, and a couple other countries, have shown that those who got hydroxychloroquine did not have any better survival or any difference in terms of how sick they got. But those who got hydroxychloroquine tended to have about a 20% higher mortality rate. So in other words, they're not sure why, but it's possible that hydroxychloroquine may actually make your risk higher.
Wow. Wow, this is...
And so at our hospital, so at some hospitals, I know for a fact that the doctors would just randomly say, okay, the person's intubated, they have COVID, so I'm going to put them on hydroxychloroquine. However, for our hospital, we would only put you on hydroxychloroquine if you were enrolled in a study. So you would be enrolled in a study so that we could actually tell that hydroxychloroquine is going to make a difference.
I see. Okay. I mean, I'm looking at, I know you are on the front line. You are out there. You just left a few minutes ago to intubate a COVID-19 patient. How are you keeping yourself safe? And our other health workers, I mean, I hear of nurses who are crying that they don't want to go back to work. ER workers, they're like, this is not. Do you have enough PPE? Do you think that you are protected against a possible infection?
Every hospital is different, and for our hospital, we are blessed to be in a situation where our hospital was very forward-thinking. So at Johns Hopkins University, at least I'm told, is that people, when they first saw this problem occurring in December, they actually started preparing at that point. And so we actually do have quite a stockpile of personal protective equipment to protect us, and but that's not necessarily the case at all hospitals.
So has there been any incidents of any healthcare frontline worker being infected in your hospital?
Yes, very, very early we had frontline workers affected in our hospital. The interesting thing is that the workers that got infected were not necessarily the ones who were taking care of the most patients. Some of them were administrators. Some of them were high-level people that were out meeting other people in the community. Isn't that interesting?
I see. Interesting.
Because in effect, one of the things that we have noticed is that we prepare ourselves so much with personal protective equipment when we go into the patient's room. Some of us feel as though we may be more protected while we're taking care of a COVID patient than if we go to the grocery store.
Well, you're right. You're right. I was at the grocery store the other day. I picked up. I tried to get some some vegetables there. By the time I held the handle, I'm like, okay, did somebody clean? Do I need to clean this? Before, at some point you just have to pray that God keeps you safe.
Right.
But I want to talk about the disparity in deaths.
Okay.
It's my understanding that many of the people, a large majority of the people who are dying as a result of COVID-19 are people of color. Is that correct?
Mm-hmm. Yes.
Why is that?
And there's even a community in St. Louis where the overwhelming majority, like almost all the people in that particular community had COVID, but that I think that community does have a high percentage of Black people within the community. And I think that there are multiple reasons. I think it's a multi-faceted thing. One of the reasons is going to be social distancing. So in every community, people aren't necessarily social distancing the same. If you can imagine this, if you're in a community where there's a lot of social problems, there's a lot of poverty, there's, and you may feel as though there are many different risks in your community. I mean, you've heard and read about people who grow up in communities whereas teenagers, they don't really feel that they are likely to live to the age of 30. They feel that they're going to end up in a gunshot wound or in jail or something like that. So in that situation, it may not necessarily register to you that this is something that you need to add on to. You already feel as though you're overwhelmed with other issues. The other factor may be access to the healthcare system. So are those people less likely to access the healthcare system? And then when they do access the healthcare system, do they get the same exact attention? So I believe that there was one observation that was made that people who are of color tend to be less likely to then get that COVID test. Remember, I described at the beginning that not everybody gets the COVID test. Only people who are getting the COVID test are the ones who they think are so sick. But what if two people came and they're both the same sickness, one's Black, one's white, but the white one, you feel that for whatever reason, you, as a physician, you connect with that patient, I don't know, or you feel bias, it could be conscious or unconscious bias, and you don't test that patient who you have some unconscious bias against, but that patient you have a connection with, you do test. So now already there's a difference in attention. And that one who you've tested, you may have decided you want to hospitalize that patient. The one you didn't test, you may have sent home and told them to self-monitor. And so there are many potential reasons for the disparity.
So how can we, as people of, how can we prevent, because I still work in Detroit, and people are out there. I see everybody with face masks. People are washing their hands, but they are still in communities. They are still clustered together. I mean, families are still meeting together. Is that?
Well, at least they have masks on, and the question is, how much of an effort are they making not to cluster together? And I would say that that just as I drive through some of these communities, because our hospital is right, literally in the center of Baltimore, I can tell you that it is amazing how I can drive through different areas and there are clusters of people clustered together doing the same activities that they would have done before COVID, and not a single one's wearing a mask, and there's no apparent awareness of this. So that is a factor. I'm not sure that factor has really fully been explored and investigated, but that's another factor for this as well. So you have factors related to the healthcare system, and then you have factors related to behavior of different populations in terms of motivation to do social distancing. You also have factors in terms of conspiracy theories and beliefs. So if I believe that COVID doesn't affect me as a Black person, am I going to social distance? No. If I believe that COVID is a hoax that's just made up, then I'm not going to social distance. So there are a lot. A lot of people who dabble in these various conspiracy theories may not necessarily realize the nature of them. The adverse effect of these theories.
I mean, from what you have seen as danger, as death, and as dismay or despair, that's from what would you advise in terms of? I mean, this is. I know the CDC has said it. What would you say to somebody listening to you right now?
So when you describe it that way, there's two aspects of it that I'm interpreting from the way you described it, because you described terms like despair and dismay and hope, but you're also asking medical questions. So we're looking at what we can do to actually mitigate the risk, to decrease the risk.
Yes.
So in terms of the dismay and the hope, then you may go to your foundation, to your faith in terms of that. And you may pray, and you may try to maintain your mental clarity. When you're social isolating, you're disconnecting from some of those support mechanisms. So you want to make sure that your spiritual life is strong, and that's going to actually help to boost your immune system and your physical life as well. In terms of what you can do from a medical standpoint, right now, the biggest tool we have is the one that's created by our public health physicians. And the public health physicians have demonstrated literally with these different epidemics in different countries that if you do social isolation, in other words, if you do their recommended things to socially separate and not spread it from person to person, then you actually can help populations to avoid getting high levels and high percentages of people who have COVID. And I think that's the best way that you can do that. So if you have, and then there's different levels of social isolation. There's one level of social isolation where you may feel that you're social isolating. Maybe you're even off work from job at home and you're by yourself, but every day 2 or 3 different people come and visit you. And those people are going and they're visiting other people, and they're visiting other people. Well, you're just bringing in the risk of infection every time that you have one of these wanderers coming to make their social house call. So again, you may be social isolating, but you really aren't doing all that you can do in that case to decrease your risk of getting a COVID infection.
I see. Anyway, I want to change gear. I know you are always in Africa. Every time I call you, you are somewhere in Sierra Leone, Sri Lanka, somewhere doing some good work. The situation in Africa, the mortality has been a little low, I would say. I don't know if testing has been as rampant as one would think, but what is happening in Africa, and why should people be careful?
So what's happening? So the first thing you have to realize is that China has been interfacing with 54 at a very high level with 54 of the 55 African countries on the continent. And so with that strong interface, there has been the presence of over 1 million Chinese throughout the entirety of the continent. So there's a lot of trade, there's a lot of movement, there's a lot of this, interchange. And so that tells you right now that there's been a level of travel communication to bring COVID in. So the African countries, have that risk, and out of the people that I personally have been made aware of to have a positive COVID result in various African countries that I've been in communication with, most of those people have been generally more educated or more well-endowed financially or more connected people who felt that they were very ill and then had the social clout to actually demand and get a COVID infection. And so if you look at the number of people who were tested in those countries, it generally tends to be relatively low. And so that means that those people who did come up positive because they had symptoms and they were able to then access a test and demonstrate they had an infection so that they could more effectively socially isolate and quarantine themselves, they don't represent how many people actually have infection within those countries. And so within any of those countries, the number of people with infection may be much higher, just as in the United States, the number of people who actually have infection may be up to 10 times higher than the numbers that we are reporting, because we also have not been really testing the people at large.
I see. I mean, that makes a lot of sense, because I know that in Nigeria, you have a population of over 185 million people. And I asked about the testing centers. You have about 6 to 7 testing centers in the country. So that tells me that if you're sick in Benin, you have to go to Irua. If you are somewhere else, you have to travel, and that is not going to happen. People are not going to travel to go get tested, in terms of the mechanism. I know that they said things are working, but I know that 7 testing centers for 85 million people is a joke. That is not going to happen. Obviously underreported. Somebody asked a question here. He said, can you give an explanation why Lagos is experiencing an exponential rise in the number of patients?
So Lagos would experience an exponential rise in the number of patients for the same reason that New York City did. In other words, these are very densely populated areas. And anyone who's been to market in Lagos, anyone who's been in a Lagosian traffic jam or done anything in Lagos knows how tightly people are packed together. And so, social isolating, not getting an infection that is rampantly being spread person to person in the community in a location like Lagos would be very challenging.
I believe so, because one of the other things that we've been thinking about is how to feed people. We are currently feeding children and some families because the average Nigerian, person is a self-made businessman. It's a small business person that lives from day to day. And there's been lockdown for more than 4 weeks. I think hunger will be the next virus that will be. So how would you, most of those people live there are about, 50 people in a compound. You're talking about social distancing. That doesn't really take place. But how do we mitigate, how do we address hunger that is on the rise? Even in the United States.
So that is one reason why the same social distancing things that we can do, but with great economic costs in the United States, become much more difficult to do when you have a high percentage of the population that makes their living hand in mouth, basically selling stuff in the market, selling stuff on the street. Many people have an informal work within an informal level of economy. In fact, in places like Nigeria and Ghana, it is a minority of the total population who even have a bank account. So most people use mobile money and other ways to exchange money other than using a bank or else just cash. And so that relates to how close anyone is from hunger. So you have just straight up hunger from children to adults. Even a week is very difficult. And these are some of the challenges that some of the African politicians and presidents face. I know that Ghana, for example, ended their social isolation thing. Well, they didn't end it; they eased up on it several days ago. But the reality is that their president is one of the most, forward-thinking presidents, around, and it's been recognized as so. But he also has to look at the issue of people starving. So it's not just a business. People will starve if they literally can't get access to food.
So either ways, people are going to. So we have a crisis in our hands. Is there any model you can? I've been thinking about some Afrocentric model, because this is just copy and paste. The United States is doing this. Let's do it in Africa. I mean, sometimes it doesn't work. Are you able to come up with any, just off of your, just thinking a model that would work for feeding? I mean, because in America, you're talking about stimulus checks being sent. That way, people are being, kind of cushioned economically, so they are getting some money. Right. But here, you're keeping millions of people. 95 million of those people already live in abject poverty.
Right.
You not add a lockdown to it. What models do you think would work at a time such as this?
I don't have right off the top of my head. I cannot tell you a model that will work. I would say that it's a very difficult situation, because you have the balance of social isolation against basically frank hunger of people who basically, it's not even a matter of living paycheck to paycheck in terms of a once every month or once every 2 weeks paycheck. It's a matter of how much money did you make today and how much money did you make tomorrow, selling it, in the market or wherever that you're doing your business. So it's a much different equation. And so I wouldn't profess to know more about that than the people who are making those decisions right now.
I know. I mean, it's been an interesting couple of weeks. Most people who have never seen this before. I mean, those who lived in the 1920s who experienced the Spanish flu, I'm sure they say that it wasn't much different than this. People have to stay in one place. But we're doing our best to feed people in Nigeria, because we just have to take care of our own people, of the people that we are feeding people in Kaduna, in Lagos, in Warri, in Abuja, in Port Harcourt, and in Aba as we speak. And
That's great.
Some information on the screen. If you want to give towards that cause, we will take it. We will send food to the people. We have partnered with caterers and non-profit organizations. We're just mobilizing them to take food to the community. Children are hungry on a daily basis, and There's no food. People, the markets are not very much open, and people don't know what to do. Dr. Sampson, thank you so much for your time.
Okay.
And your last words.
Is so your organization. What's the name of your organization again?
It's called Healing Hand Health Society, based out of Nigeria.
Okay. So one of the groups that we partner based out of Ghana is the Diaspora Africa Forum, based in Accra, Ghana. And so, I would say that would be a good organization for Healing Hands to basically connect with.
Okay.
The Diaspora Africa Forum is connected with individuals, diplomatic and grassroots throughout much of the continent of Africa. And so that would be a way of extending the reach of your work, and also improving even donations to help extend that reach.
Okay. Thank you so much. And we also have, if you're listening, if you have any questions for Dr. John Sampson, please, I know he's about to go back to work, but I'm just going to wait for like 5 minutes, how much time do you have, Dr. Sampson?
Oh, I've got plenty of time right now. Yeah.
Okay. All right. So let's wait for like 10 minutes if you have. We did, Dr. Sampson, I wrote a song, produced it, and that song, the sale of that song track is helping to feed people in Nigeria. So
okay.
the song's available on iTunes. It's called Rescue Me. By the name of our band is Tribes of Issachar. So we just sent it out, and it's 99 cents. Everybody can get that. With that, we can support our feeding programs in Nigeria. So I'm going to wait. If you have any questions for Dr. Sampson, we will take it. the point where she went. There's a little clip here. Okay, yeah, this is where she got some food and she began to distribute. You know, she put a food pack together and took it to that community. There were so many people there, very crowded place. Well, she went there, she put some food packs for families. So a family of 4 can survive with foods that cost about 7,000 naira, about $20. About $20, we were able to get food that would last a family of 4 for 2 weeks, hopefully. And you're talking about millions of people. This is something that everybody should get into. The place, look at the place. Who is talking about social distance in this place? You know, it's not happening. So many children, makeshift. It is something else. Anyway, that was what happened there. But what can we do? We just have to take care of our people and make sure everybody's safe.
Right.
When are you going back? Do you think you are going back to Africa soon?
Right now, there are several reasons why that impede my travel to Africa for the current time. Number one, the workload here. Number two, travel restrictions as well. And so we're actually working with our African partners by doing online training of healthcare providers in Africa using telemedicine, teleeducation, and medical simulation. So we're training doctors on the continent and West Africa how to use mechanical ventilation to treat COVID patients, and pairing that with their acquisition of ventilators that are actually designed for the African environment.
Have you had a social association with Nigeria?
Not in this. Our partner in Nigeria, our closest partner right now in Nigeria, currently is Lagos University Teaching Hospital. But right now, Nigeria is actually, doing quite a few things to get ahead of the influx of COVID patients as much as they can. But we are working with the Diaspora Africa Forum. We're working with, they're a partner of the Africa Union, and they have made ECOWAS also aware of what we're doing. Our current project in Sierra Leone is also partnered, I should say is requested by the President's Office of Sierra Leone, as well as the Ministry of Health of Sierra Leone. So the program that we're putting together is one that can be replicable and portable to any different location that wants to improve their ability to provide mechanical ventilation to the sickest patients that may get this infection.
Okay. Anyway, be safe out there, and hopefully once these travel restrictions are reduced a little bit, we can take part in some interstate travel. But right now, I guess Zoom and YouTube and phone calls are the things that we have for right now. You be safe out there. Take care of yourself, and I will talk to you very soon.
All right. Thank you. And you too. Thank you very much. Okay.
That's Dr. John Sampson, all the way from yes, he joined us all the way from Maryland. Johns Hopkins University was very, they've been talking about COVID, a simulated COVID infection in last year. They've been thinking about it. There's several models they brought out there. If you go online, go to YouTube, it's called Events 201. They had a premonition. They had some models that they put out, and I think you've heard it from him. Their hospital was well prepared because they knew something like this was coming. I mean, the places where they are not prepared, that is where you begin to see, people being overwhelmed by the system. My prayer is that you be safe with your family. My prayer is that you would, at this time, find time to connect with your God, because we have an opportunity here, to be quiet with, just to connect with your creator. We have an opportunity to do that in a couple of weeks. You are social distance, you're away from people, you're away from all kinds of influences. I pray you use this period to learn something new. And for those of you who want to be a part, if you want to be a part of what we are doing, if you want to be a part of meeting the needs of others when we are, the whole world is in need. I'm gonna play a video today. We had an interview with a public health specialist in all the way from Oyo State in Ibadan. I'm gonna bring her on. We had an interview for a couple of minutes. I'm gonna play the full length of this interview, and do have a wonderful time viewing it. And I'll be back in a few minutes after the end to just speak more on what we need to get done.
Ẹ̀yin èèyàn mi, ẹ káàsán o, ṣé dáadáa la wà o. Gbogbo nǹkan táwọn ìjọba sọ fún wa pé ká máa ṣe, ká dúró sílé, ká má jáde. Torí àrùn coronavirus tó wà níta yìí, ẹ jọ̀wọ́, ẹ jẹ́ ká kárùkù mọ́ nǹkan tí gbogbo àwọn ìjọba ń sọ fún wa láti dúró sílé, láti máa ṣe nǹkan tó ń pè ní social distancing, láti dúró lọ́tọ̀ọ̀tọ̀. Torí àrùn èèyàn lè kó nípa sísí, nípa kí kéèyàn ti fọwọ́ kan ibi tí coronavirus tó ti affect. Ẹ jẹ́ èèyàn wa, ẹ yẹ ká gbọ́ nǹkan tí àwọn ìjọba wa ń sọ. Ẹ yẹ ká dẹ̀ máa fọwọ́ wa lóòrèkóòrè lábẹ́ omi. Ẹni tí ò bá ní hand sanitizer, kó ra ọṣẹ àti omi tó máa fi fọwọ́ rẹ̀ lóòrèkóòrè. Kí a dẹ̀ máa ṣe gbogbo nǹkan tí ìjọba sọ fún wa. Ká bo imú wa. Ká bá fẹ́ sí, ká fi ọ̀ká sí sínú ọwọ́ wa. Ká má jẹ́ kó bọ́ síta. Ẹ̀yin èèyàn mi, àní rí àìsàn ní ṣe wá o. Àjíǹde ara máa jẹ́ sí gbogbo wa o. Ó dàbọ̀.
Healing Hands Health Society, in collaboration with our in-country partners, presents Feed the Hungry Nigeria. Nigeria is on lockdown. With this stay-home order, hunger will be on the rise. We cannot fold our hands and wait. We have partnered with caterers and non-profit organizations to distribute food in Lagos, Ibadan, Abuja, Kaduna, Warri, and other major cities in Nigeria. To support the Feed the Hungry FTH project, you can send your donations to the account below. Account name, Healing Hands Health Society. Account number 0803479982. Or go to GoFundMe, Relief Mission to Nigeria. For sponsorship, please call 080-2322-9290 or email us at info@hhan.org.
Good afternoon. My name is Honorable Uvo with Real Relationship Television. Today we have a public health specialist with us this afternoon. Mrs. Yetunde Adeshaluka Oladejo, a public health specialist, a nutritionist, all the way from Oyo State in Nigeria. Welcome to the program.
Thank you.
I did see your a post you put on LinkedIn, and that is why I decided to reach out to you to talk about the role eating well plays in the fight against COVID-19. What do you have to say about that?
Yes, COVID-19 has come, and everybody is afraid. Everybody is panicking, but what we eat plays a lot of role in warding off infections. How do we build our immune system? How do we make our immune system strong to be able to ward off any infection, including COVID-19? What we eat, they say, is what reflects in our outward appearance. And what I would say is eating well, having different kinds of foods in our meal would help us to protect our immune system against COVID-19. If we are able to have different food, for instance, in our food pattern, if we are able to have a little bit of vitamin A foods, a little bit of proteinous foods, a little bit of carbohydrate food, all meshed together on our plate. We always call it a colored plate. When we have all of this meal on our plates, combining all of these nutrients, we have vitamin A, vitamin B, vitamin K, we have magnesium, we have all these micronutrients on our plate. It will help our immune system and boost our immune system to be able to ward off any effect, including COVID-19.
So the layperson goes out to the market, doesn't know anything about trace elements, doesn't know anything about all the things you just talked about. So what kind of food locally do you think, added to our diet would help to strengthen our immune system?
Yes, thank you very much. For instance, we have food like tomatoes. Everybody knows tomatoes. We have food like carrot. Carrot is in season now. We have food like mango. Mango is in season. We have food like cucumber is in season. We have cabbage is in season. Everybody knows how cabbage looks like, knows how sweet potato looks like, knows how cocoyam looks like, knows how beans looks like. When we have all of this food prepared together and placed on our plates, we are able to eat good food that provides our system with all the nutrients that the body needs to be able to grow well, to be able to build the immune system, and be able to ward off any infection. And also including water. Water is important in every of the meal we take. And also, if we are going to be taking any processed meal, it's always better. We always tell people to limit or even eliminate eating processed food in their food. So yes, it's always good, 100% healthy, 100% good for the system to go for natural foods. Tomatoes, carrots, cabbage, sweet potato, cocoyam, bitter yam, beans. They are all foods that are able to protect our system from any infection. If we are able to combine all of these foods together on our plate to eat.
I know, there's lockdown in Nigeria. I don't know how many people saved food. I don't know how many people have a very, large food bank. So what happens to people who, I believe the average Nigerian is a small business person that makes their living from day to day. Now that people have been in lockdown for more than 3 to 4 weeks, what do you think is going to happen to families?
Well, it's a tragic situation. It's so tragic. But in Nigeria, as we are speaking, we still have people moving around, trying to sort out how the family will eat. Even from your state where I'm speaking with you, we still have people moving about, selling food. Food sellers are selling. Beef sellers are selling. Everybody, transport workers are working. Everybody are just moving around.
Are you saying there is no lockdown in your state?
There's no lockdown. There's only curfew. You are supposed to be back in your house by 7 p.m. in the evening. So we don't have a lockdown at the moment in your state. So everybody still go about their business. So you're still able to get food. You're still able to transport yourself. You're still able to get whatever you want to get. The only thing that is happening is sensitization. We are talking to people to close their nose, to use nose masks, to wash their hands. Whenever you are going out, go with hand sanitizers. When you go to banks, they will give you hand sanitizer to clean your hands. When you touch the ATM machine, they give you hand sanitizer to clean your hands. That is what is happening in your state. So people are still able to source for food, get food to eat, and all that.
So do you think that people understand what social distancing is and how it helps to prevent disease?
Based on my perception, people don't. Even in urban areas, people don't. Don't even let us talk about the rural areas. In urban areas, people don't. Let alone the rural areas. So most of them in the area does not even understand what COVID-19 is. They don't even know, they don't even believe that there is something like that occurring right now. They don't see the efficacy of what people are saying concerning this virus. And it's tragic. There's nothing we can do about it.
So it sounds like most people are in denial about COVID-19.
You can say that.
I mean, our prayer is that, there is a solution soon. I mean, there's been several predictions by even people who have been working with vaccine industry for years that there's a large death of people looming in Africa because of our attitudes and our preparation towards COVID-19. I know you've worked for a vaccination group before. Do you think that it will be easy to send that vaccine? Because there are also conspiracy theories where people are touting the fact that you should not take a vaccine. What do you think the role of vaccine would do in this scenario?
Vaccine has helped us. Look at how vaccine has helped us to kick out polio, helped us to kick out all sorts of diseases that would have killed many children, that would have turned many children to handicaps, or many children to something that their parents would be weeping about. So vaccine has a whole lot of role to play. And I don't really think people should turn their back against vaccine. We've been getting vaccine for what now? Many years back. So I don't think people should turn their back against vaccine. I don't think so. But there are many underlying factors. That is another thing. There are underlying people's perception, news flying around about the vaccine for the coronavirus, and it's going to take a whole lot of sensitization and education for people to really, really adopt taking the coronavirus vaccine. Because, people are really, really afraid. Okay, let me say people are afraid.
I want you to say, in your last words here, you are Yoruba, right?
Yes, I am.
To speak your language to somebody out there, okay, to let them know that coronavirus is real and all the things that they can do to prevent it.
Ẹ̀yin èèyàn mi, ẹ káàsán o, ṣé dáadáa la wà o. Ṣé gbogbo nǹkan tí àwọn ìjọba sọ fún wa pé ká máa ṣe, ká dúró sílé, ká má jáde. Torí àrùn coronavirus tó wà níta yìí, ẹ jọ̀wọ́, ẹ jẹ́ ká kárùkù mọ́ nǹkan tí gbogbo àwọn ìjọba ń sọ fún wa láti dúró sílé, láti máa ṣe nǹkan tó ń pè ní social distancing, láti dúró lọ́tọ̀ọ̀tọ̀. Torí àrùn gbogbo èèyàn lè kó nípa sísín, nípa kéèyàn ti fọwọ́ kan ibi tí coronavirus tó ti affect. Ẹ jọ̀ọ́ ẹ̀yin èèyàn wa, ẹ yẹ ká gbọ́ nǹkan tí àwọn ìjọba wa ń sọ. Ẹ yẹ ká dẹ̀ máa fọwọ́ wa lóòrèkóòrè lábẹ́ omi. Ẹni tí ò bá ní hand sanitizer, kó ra ọṣẹ àti omi tí ó máa fi fọwọ́ rẹ̀ lóòrèkóòrè, kí a dẹ̀ máa ṣe gbogbo nǹkan tí ìjọba sọ fún wa. Ká bo imú wa, ká tá bá fẹ́ sí ká sí sínú ọwọ́ wa, ká má jẹ́ kó bọ́ síta. Ẹ̀yin èèyàn mi, àní rí àìsàn ní ṣe wá o. Àjíǹde ara máa jẹ́ ti gbogbo wa o. Ó dàbọ̀.
Thank you very much. That was wonderful. That was fantastic. Thank you. Mrs. Yetunde Ade Sheluka Oladijo, all the way from Ibadan in Oyo State of Nigeria. You have given a very good account of yourself, and hopefully in the next couple of weeks, you can identify some people in your environment, and we can do what we can to send some aid to them through you. Okay. Thank you so much. We really appreciate your advocacy, and I believe that people are going to hear about what you just said, and people will take your advice. God bless you. This song was written by us to bring some kind of succor and help and hope to people. It's available on iTunes, it's available on Spotify, it's available on Apple Music, and it's 99 cents. I need you to go out there and to make a purchase. Every cent received from this single track goes for our feeding programs in Nigeria. Would you go to Apple Music right now? The title of the track is Rescue Me by Tribes of Issachar. It will bring some succor to somebody out there. So this is our contribution. We want to be able to raise some funds and be able to send out the word. It is a scripture, and it will bring some gladness to you. There's an instrumental version as well. If you go to iTunes, you can find the song. Proceeds of it supports our work. I would really appreciate it to have you, go to tell your friend. You can share it as well. You can go to oasis.hearnow, here as in HEARNOW.com, oasis.hearnow.com. You can find us. You can find everything in one place. You can order it, and when you get it, you are sure helping to feed somebody in a part of Nigeria. Thank you so much. It's been wonderful having you listen to our interesting interviews with Dr. John Sampson of Johns Hopkins University. And earlier, we interviewed a public health specialist all the way from Oyo State in Nigeria. Please, let's take this seriously. COVID is real, and you can make a difference. God bless you. So until I come back your way, always remember that God is in control.